our friends to continue with their role of building trust within the system. Universal health coverage is a journey, and it requires that we all have the discipline to communicate what is helpful to Nigerians. And so, in conclusion, the health of our nation is our true wealth. The health of our nation is its true wealth. Investing in a robust healthcare system is not an expense. It is an investment in our productivity, in our economy, and in our future. We believe that with a reimagined approach to financing, we have the collective will to make the change. And I hope that this dialogue will be the start of a new chapter where every Nigerian can access quality, affordable healthcare without fear of financial ruin. Thank you very much for the audience.
Well, leadership by example. I think she deserves a very, very loud round of applause. It is workable, the collaboration across quarters. It is also gratifying to note that she has devoted her constituency allowance to ensuring better health for Nigerians in her constituency. I hope that my colleagues will make this loud so that other distinguished members of the National Assembly, the state assemblies, and cascade good health to all Nigerians without having to worry about out-of-pocket expenditure. We're moving on. You would recall that during the course of this event, we have with us the man who holds the purse, and he's nodding very happily to me, so I can say it. And we hope that the purse today will open further and wider. Is it an agreement? Is it a consensus in this house, in this room? All right? So we have that consensus, and it's on that I want to invite the coordinating Minister of Finance, Mr. Wale Edu, to please speak to us as he opens the purse wider.
Thank you, and good afternoon. Let me, first of all, recognize someone who was with us virtually earlier, Governor Charles Soludo, Governor of Anambra State. My colleague, my friend, my brother, the Honorable Minister for Health and Coordinating Minister of Social Welfare, Professor Mohammed Ali Pate, the Chair, Senate Committee on Health, Dr. Harry Panigo. At this point, let me say welcome to the AU Commissioner for Health, and of course, Permanent Secretary Health, the heads of agencies, civil society, our development partners, all those who are helping us with the health agenda in Nigeria, gentlemen of the press, distinguished ladies and gentlemen. It is For me, an absolute pleasure to participate once again in one of the many initiatives, projects, and platforms, fora, that our very able, very cerebral, and much celebrated Honorable Minister for Health and Coordinating Minister of Social Welfare has put together. And I really mean that. He's naturally tried to stretch the finances of Nigeria by trying to attract as much as possible to the health sector. But not only, I mean, look at this hall today. This is the fourth day of a dialogue, and it is the afternoon. The place is packed to the limit, every seat taken, and it's a sign of the capacity of Professor Mohammed Ali Pate to bring together, to convene top elements in the health sector to forward the agenda of health in Nigeria. Today, we are talking about health financing. But you know, I've been all over Nigeria with him, opening radiology and diagnostic centers in Bauchi, opening oncology centers in Katsina, Enugu, Edo. He's everywhere. And he's implementing a major mandate in terms of the social and health reform agenda of President Bola Ahmed Tinubu. More grease to your elbows, sir. Please keep it up. This national financing policy dialogue, and he has encapsulated it. Financing for health is about a growing economy that gives you financing, that gives people jobs, that gives them incomes. It is about government having increased revenues to put into the health sector. And of course, it is about being able to crowd in the private sector where the real money is. We know that Mr. Bill Gates, the philanthropist, as we recognize him now, says that it's where the public sector and the private sector leave a gap that philanthropy comes in. So definitely, of course, that philanthropy sector is also critical and important for financing of the health sector. But this dialogue is critical, urgently required, is in alignment, as I said earlier, with the reform agenda of President Bola Ahmed Tinubu and his pursuit of inclusive growth. You all know, we don't need to repeat, that health is wealth and how critical that is to the economy. But it is a reflection that our success in healthcare requires a coordinated system that mobilizes, pools, and allocates financial resources to ensure that we have equitable access to health for our population and the required investment in medical services. We've heard the breakthrough in terms of health insurance so that people don't have to put their hand in their pocket every time they need health care. That, as we all know, is not the way. And wherever you are in the world, when you need health care, it is much more accessible if it has been pre-planned, prepaid for, or you have an easier way of paying for it than having to pay on the spot. That is most difficult anywhere in the world. And that's why rebuilding the economy fit for our people's ambitions is what is going on at the moment. Important, bold fiscal steps continue to be made to restore stability and make sure that the gains from the economic recovery are felt where it matters most, in the clinics, in the community, and of course, in the households. We've heard about, and I'm sure you're all aware of the improvements in healthcare at the primary healthcare level. More practitioners being trained, better management of healthcare at that all-important level. But let's look at the context in which we are talking about financing of healthcare. Apart from addressing decades-old macroeconomic distortions, and we all know what they are, and then creating a stable macroeconomic environment where private investment can thrive, where it can come in at scale across all sectors. We now have a situation where there's an attempt to build government savings so that will enable investment, public investment in assets, in critical sectors, infrastructure, health, education. And by doing this, government becomes a catalyst for the private sector. It was said earlier, and I'm sure it will be repeated, the private sector is critical in financing of health facilities, provision of healthcare throughout the country, just like in other sectors. And over the past 2 years, the bold reforms, yes, they have come at some cost as you repair and you fix some of the things that were broken in the economy. So the removal of subsidy was a decision that was tough, but it has restored fiscal balance, not just at the federal level. The states, they have much more money. They have double the kind of funds they had before, and so they are able to provide their own contribution in this all-important area and others. And let me here address something that Professor Pate remarked on, and that was a source of funding that brings together federal, state, and local governments, and that's the federation account. And I think any initiative there, any ideas or suggestions, the rightful place for that discussion is within the National Economic Council and the Federation Account Allocation Committee. That's where such ideas and proposals should be presented and can be meaningfully discussed, and hopefully with success in terms of coming up with viable ways of financing healthcare in addition to everything we have mentioned. In addition, just to give us a sense of how we are moving forward and getting the funds that are necessary for this critical, for funding of this critical area, which there's nowhere in the world where without a viable public health system, social welfare system, you can say that you have a caring, a modern, and a progressive economy and society. So we have signed into law comprehensive tax reforms, simplifying compliance, reducing nuisance taxes, and strengthening the administration. And we are driving structural reforms in energy, education, logistics, such as the CNG initiative. And importantly, we continue to build using digitization, automation, and technology, a social safety net that is getting more and more robust, that allows intervention directly to people who need it in a form of financing. And these reforms, they're all meant to build a competitive economy, an efficient economy, and as I keep repeating, one where private investment, whether local, domestic investors or international investors, where they can thrive. In terms of healthcare, of course, when you remove a distortion such as a subsidy which was only benefiting a few and even benefiting foreigners, and it was gulping about 2.5% of GDP. When you remove that, the opportunity cost was that there wasn't enough funds for investment in healthcare, education, and so forth. Therefore, it will take time, and it is taking time to recover the kind of investments that have been lacking over the years. And that's why Professor Pate is in such a hurry to open up so many healthcare centers, radiology centers, oncology centers. And we must remember there's a financial, economic imperative to this. The more of those facilities that you have in Nigeria, the less people not only need to spend hard-earned foreign exchange and time and expense to go abroad for. In fact, you have the reverse. You now have facilities with which you can attract foreign exchange. You are exporting your services by people coming in and using those services and paying foreign exchange and allowing economies of scale and full utilization of such facilities, even though we know they are primarily for Nigerians. So we now have 4 elements to our growing economic stability. The external reserves position is strong. The fiscal position has meant the elimination of routine use of ways and means, printing of money. The economy is growing at about 3.4% last year. Well, when you have growth, you have job creation, and you have elimination of poverty, reduction of poverty, which is the overall aim of His Excellency, Mr. President. But not at 3 or 4%. We're looking to, within the next couple of years, 7% per annum growth, because that will be more than double population growth, and that is when you start lifting Nigerians in their millions, in substantial numbers, out of poverty. That's the aim. Of course, inflation is moderating. It's about 4 months now. For about 4 months, inflation has been going down. May I say more importantly, as at July 1, I did join the Honorable Minister of Health and Coordinating Minister of Social Welfare, as I said, to open up, establish, and launch oncology centers in the northwest and the southeast of Nigeria. And the important thing is that without the reforms that have taken place, these investments, the establishment of these facilities would not have been possible. So there's a direct correlation and link between correcting distortions in the economy, having the economy grow, and putting more facilities on the ground in the health sector. Let me mention that today, private spending on healthcare in the private spending accounts for 74%, as we said earlier, 74% of health expenditure, while the public and donors account for about 14.4% and 11.6% respectively. What I think I'd like to emphasize about our ability to spend on healthcare is that it has been greatly impacted with the changes in the global economy and world order, I may say, particularly in WHO, World Health Organization, which lost about 40% of its funding, as we all know. It impacted Nigeria. I think we were getting about $800 million a year in support for various initiatives in tuberculosis, malaria, and so forth. But our ever proactive Minister of Health, immediately that announcement was made, went to work with his team, and he found that through careful calibration, we could use a much lower sum to replace what had been lost. There were savings that could be made from smarter purchasing and so on and so forth. And so immediately came back with a much lower budget to ensure that we Nigerians did not suffer as a result of the fact that something that had come to rely on was no longer there. He reacted immediately and filled the gap, and we're grateful for him for that. Of course, as we heard, the President has taken the lead in directing the implementation of mandatory health insurance across all MDAs. It's a very notable, very laudable, and critical initiative because, as we had said earlier, it's so difficult when falling ill on the spur of the moment to just find the money from the normal budget. So insurance is critical in giving Nigerians access to the health care they need when they need it. So now we must follow the President's lead. If there's insurance, there must be enforcement. And I think this dialogue is a great start. And I have no doubt that the scale and detail of this dialogue can only mean robust, actionable, implementable policy proposals that will make our healthcare investments not just possible, not just larger, but also sustainable. The whole important thing about so many policies and initiatives is, one, to implement them, but then two, to be able to sustain them over time so that you grow and develop them rather than have them recede. And I think in terms of insurance, our first lever is risk pooling. From cash at the counter, as I said, to care on coverage. And we need to accelerate the National Health Insurance Scheme. And as we said, the states, as Professor Soludo even indicated, that the states need to also play their role to protect the poorest with premium subsidies and to enforce one-time payments with short-term claims. So essentially, let me say that things like, as Dr. Banigo also mentioned, data, published scoreboards. And we know that when households are protected, they seek care earlier. And the providers of that health gain steadier cash flows, and the system becomes investable. You need a system that works, a system where the premiums are paid, claims are paid, and the whole system is funded in a way that is sustainable. So I think we all collectively have need to coordinate to ensure that this important health insurance initiative works, and it works well. It is key to sustainable financing of the health sector. Macroeconomic stability is also a health policy by other means. But it only counts if it changes the experience at the primary healthcare center. Budgets do ignite the effort. Insurance and investment scales it. And today's directive on health insurance helps ensure coverage is not just is not optional. Coverage will not be optional, and it is operational. And we need to stay the course. We need to be disciplined, data-driven. We need to collaborate. We want the clinic at the corner to become the first stop, not the last bus stop. Oh. Thank you very much indeed.
Thank you. We need to collaborate. We need to also ensure the operations of the primary health care. But most importantly, we need to take health financing seriously to reduce the burden of health care. We are moving on. I'm going to call on one of the gentlemen that have been assisting and part of the LOC. I'd like to invite Dr. Ozoma, who would lead us into the next few sessions, and then we'll come back. At this moment, I'd also like to refresh us that we are live on Nigerian Television Authority as well as Channels Television. You have the microphone.
Honorable Ministers, Permanent Secretary, distinguished guests, ladies and gentlemen, we've listened to very interesting interventions from the Minister of Budget and Economic Planning, Minister of Finance, Minister of Health. We now want to convene a panel where we would then listen to contributions from our distinguished guests and also take questions from the audience who have been itching to ask questions to the policymakers. And I would just very quickly invite to the stage. I would invite members of the panel to the stage, and okay, so as the Honorable Minister of Finance and Coordinating Minister of Economy takes his leave, I would just invite to the stage distinguished Senator Ipalibo Banigo, the Chairman, House Committee on Health, Secondary and Tertiary, to Senate Committee, to please come to the stage. I would also invite the WHO Regional Director, Professor Mohammed Yakub Janabi, to also join her on stage. This panel will also be joined by the Coordinating Minister for Health and Social Welfare. As soon as he returns into the hall, he would join the panel as well. Together, we would be listening to diverse opinions from translating legislation, budgets, and policy into action towards universal health coverage. And You're welcome back, Honorable Minister. Thank you, Honorable Minister. The Honorable Minister has to make sure that we secure the bag. Thank you, Honorable Minister. I would just invite Dr. Donald Kaberuka, AU Special Envoy, to mobilize international economic support for continental fight against COVID-19. So please join Honorable Minister and distinguished Senator on the stage, sir. We would await the Regional Director for WHO Afro to also join the panel, but I would just immediately invite the moderator for this session, Oluyomi Akinyemi, from the KPMG, to take over proceedings and engage the panelists. So Yomi is going to be taking questions from the audience and would also throw questions, his own questions, to this panel. We've had very interesting conversations in the past 4 days now.
Good afternoon, everyone. My name is Yomi Akinyemi, and I'm a partner with KPMG. We've been, it's normal to start sessions like this with standing on established protocols. But as this is our first fireside chat, and I'm also seated on this side, with the coordinating minister of Health and Social Welfare, we also heard the coordinating minister for the economy and the minister of finance having an important conversation around health financing. But because we are seated, I think it's appropriate that rather than standing, let me sit on established protocols. I don't take lightly the importance of this conversation. All week long, we'll be having conversations around health financing, and it brings in one room 2 coordinating ministers to talk about health financing, being at the intersect of what the conversation is about. So it's indeed my pleasure and a privilege to moderate this session. I'll start with a few questions, and then of course I'll open it up to the audience and those online to also participate in the dialogue that we're having today and that I've been having all week long. So I recognize our panelists. Professor Pate. I also recognize the Senate Chair on Health for Secondary and Tertiary, Dr. Harry Banigo. I also recognize Dr. Donald Kaberuka. Thank you for visiting. So I'll start with a few questions. And my first question will be addressed to Professor Pate. We'll be discussing innovative domestic financing. Several months ago, and it continues to date, we've seen a declining source of donor funding. So what are your thoughts as to the options we have to drive innovative domestic financing, especially as we are looking at health financing, the role of public-private partnerships, the role of sin taxes, and the opportunities around these diverse opportunities?
you. I think the last 20, 25 years have been the golden era of global health and global financing. Before then, we didn't have many of the instruments that we have currently. The Global Fund, Gavi, many of the instruments that support countries were not in existence before 2000. Since their establishment, we've seen dramatic increase in resourcing of health, which is because of the global solidarity and the contribution of taxpayers from all over the world to key challenges, HIV, TB, malaria, vaccination. And I think we have some results to show for it. But we also know that even before COVID, the pace of progress was slowing down, and things like financial protection were going in the wrong direction. And more than half the world's population, and in Africa, more than half the population, lacked access to basic quality health services. And COVID exposed further flaws. And since COVID, many things have unfolded, and shifts in politics, nationalism, weakening of global solidarity. I think it pushes the global health entities and challenges them, especially given the multiple competing priorities from those who are funding them. So for us in countries like Nigeria, while we appreciate all the contributions of the past, the changes in the last 8 months are a wake-up call, I will say an opportunity to face the reality that we cannot hope to build a healthy society for our people on the back of somebody else's money. That we have to find ways to take ownership, to use the resources that are currently on the table, but to be on a path where we exit the paradigm of dependency that was beginning to settle in. And by doing so, be more efficient in deploying our resources, the quality of our spending, and look to where we can mobilize additional resources domestically, as we have heard from Minister of Finance, and those mechanisms that will allow us to control the priorities, industrialize, produce some of the things that we have. Many of the items that we were receiving from the global health assistance were commodities, but they are not produced here. We should be looking beyond that, where the things that we can produce, there's an economic value also that we can create, even while addressing the consumption needs or the inputs that are needed to deliver quality health services. So we see this as an opportunity, really, a moment of reset, while appreciating the past, but looking forward to a different kind of relationship with our partners from the wealthier countries, but also from within our continent. Because at least in the context of Africa, we are close, we share many things in common, and we share many things with other developing countries. But within that context, in a respectful manner, not in a positioning of a supplicant, but where we take responsibility and we step up while our partners support us to achieve common objectives linked to our humanity, and when issues arise, that we deal with them together. That's what Nigeria has tried to do. The sector-wide approach prepared us very well, and as you have heard, the political will was there from the president and other members of his team, and I think we're on that path, and the discussions here today are just refining or making it more evident the options ahead of us to move in that direction, whereby we increasingly efficiently mobilize our domestic resources. If we reduce out-of-pocket spend, expand the risk pool through insurance, where just by doing that, bringing in more ability to pay for our healthcare domestically, and the progress that we have seen, in fact, has been financed domestically to a large extent, but it was just inefficiently financed. So if we organize it better, we can purchase better, and our people will get the help that they need. And a last point is, because the supranational priorities dictated where we are going for a long time, And while we have results to show for it, if we don't have enough resources, then we have to rebalance the imperative from a primarily disease-focused one to one that balances the disease-focused effort with the health production side as well. So preventing NCDs, dealing with food systems, processed foods, for instance, trans fats, salt, sugar, and other things, vaccination, water and sanitation. So health in all approach rather than just public health by itself. Do you get me? So there's a need for that because that's stretching public financing to deliver a lot of value in terms of health outcomes for our population. What health can do and what sectors other than health, the social determinants can also do. And I think that's why it's so important to have finance ministers, budget ministers, and other ministers in our team really tune into this as part of this adjustment to the reality that we have, not just about the diseases.
Thank you. As you spoke, it was clear to me that the significance of the task ahead of us is quite extensive. My next question will be to Dr. Harry Banigo. It's really to speak to how do we, in your words, the minister, drive ownership? How do we drive ownership at the subnational levels? State and local governments, and looking at it from an executive and legislative agenda. What are your thoughts in terms of how we can work with the states better to actually drive the agenda on an overall basis?
Thank you very much. I think this is a good opportunity for us. We are actually from always looking at the unending supply, always thinking of the supply there. We're now really coming to look at the real issues. And that is why our Legislative Health Summit, which we held one last year, we're holding another one this year. We are conscious of the fact that we need to have a learning agenda across the subnationals. And when we bring the chairman of the health committees of the various state houses of assembly, all 36 of them attend this health summit. They come with the secretary of the Committee of Health, they come with the chairman of the Appropriation Committee, and also the speakers of the different houses of assembly. And it is an opportunity for us to share information across one another. And in some areas, what has worked, and they can share that kind of information. And so that kind of learning agenda enables collaboration and coordination of activities across health to improve health outcomes. Because everyone is interested in seeing how we can improve on the health outcomes that we have. When we are not happy when we see Nigeria being given, having the highest maternal mortality rates, child death rates, neonatal death rates. And so some states will have examples where what they have done in their states, maybe the way they have used data, maybe the way they have used community development committees at the primary healthcare centers, how they have supported capacity so that they can actually see what is the progress of their primary health centers, take ownership of the primary health centers, and be able to say, look, there's no water here. What can we do to provide water? Or there's no light. What can we do? Can we bring in solar plants to ensure? Can you imagine the health center that has no light, that is dark? Which patient or client would like to attend that kind of health center? Or a health center that has no running water? It just doesn't make for sanitation. It doesn't encourage a clientele, a patient, to approach such areas. So it is important for us to be able to continue to drive this type of this platform where we can exchange ideas of what has worked in each state, in each local government, And then others can also learn from it. And others can also bring their own thoughts about how it should be. For instance, I can tell you that some people believe that we could make better use of just making health information available on simple mobile devices, very simple ones, that can help people to know, look, if you have frequent stools, don't do this and do this and so on. You know, our mothers in the villages, they all have these very simple phones that they use maybe to receive small sums of money from their children in the cities, 5,000 naira or whatever. And we could also use this, leveraging networks, data networks and so on, to provide simple but targeted health information. And that also came up and was discussed, and some communities are using it. So we need to strengthen our village development health committee, our primary health care development committees. We need to strengthen them. We need to let them know that this thing is all about them, so that when the health center is in their community, they can actually take ownership of it because they are participating in it. And it doesn't take much to encourage them. I recall that when I was a deputy governor in Rivers State, I was chairman of the task force on primary health care and immunization. And we had some of our partners used to help us to develop and encourage participation of these primary health care centers across all the primary health care centers in the state. And that way, you found them that they really valued the health centers, and they were eager to see that they actually work and that the communities attend them, instead of going elsewhere where they are attended by unskilled attendants. And that again shoots up the negative health outcomes in our communities. So these are the things that we can do, and I believe that sharing learning agenda in this way does do a lot to improve our general outcomes on health. Thank you very much.
Thank you. When you spoke earlier, there was a lot of passion in you discussing the personal and collective initiatives you are championing around health financing in the Senate. I would like to extend this question on the back of that, and this question will be going to Professor Janabi, the WHO Regional Director. Focusing on the poor and the vulnerable, what are your thoughts around improving on equity financing to support those disadvantaged groups on a general basis?
Yeah, thank you very much for that important question. I think I'll try to pick up from where Professor Pate touched a bit of it. Towards the end of January, everybody knows what happened. Without caution, without being transitional time, no honeymoon. One of our largest donors in WHO pull up the finances, and the consequences follow up by the ODA reduction of sorry. Can you hear me now better? Thank you. It's lunchtime, maybe the sugar is going down there. So what I was saying, let me pick up where Professor Pate started. The beginning of this year, we saw the financial reduction to WHO. One of our biggest donors pulled out. The ODA funding went down. And it's a time when I was in my campaign for the position which I am today. So among the questions which I asked myself, how is the financing in WHO? So you have the assessed contribution and you have voluntary contribution. Our assessed contribution was up to 20% and sometimes less than 20%. The voluntary contribution is 80% up. So one of the questions I was asking myself, do we really own WHO? Because if it was a business entity, you are the minority shareholder. So to fast forward, the member states, I'm very grateful with also the initiatives, the assessed contribution, all the member states have agreed to increase it, hopefully, and wishful by 2030, at least we should reach to the 50%. And the initiatives you are seeing today of member states trying to take ownership of their health, this is the only way we can reach those most vulnerable. Because coming back to Afro, where we have 47 member states, the priorities of Nigeria can differ from priorities of Burundi. Priorities of Burundi can differ from priorities of Cameroon. So the question we as WHO Afro, how can we reach the most vulnerable? These are the measures which I'm here in Nigeria, and a living example of the initiatives which Nigeria is taking. One of them endorsed by His Excellency, President, is universal health coverage. Let me remind the audience, COVID-19 exposed us how fragmented, how weak our health systems are. And I wish we had learned from some of the lessons from COVID-19. I will cite one simple example. During COVID-19, I was leading one of the hospitals in Tanzania, our national hospital. We saw the trends of diarrhea diseases going down. We saw the trends of respiratory diseases going down. Do you know why? Simple measures were taken. People are using sanitizers, washing their hands, wearing masks. These are simple measures which brought down everything else apart from the COVID, which was the main disease. Today, we in Nigeria, let's talk of Nigeria. The target is to get 120,000 community health workers. Outbreaks starts in the communities and end up in the community. Services. And I will cite a simple example for the time's sake. You have two types of diabetes. Type 1, which is insulin dependent, and type 2, non-insulin dependent. Before you get full-blown type 2 diabetes, you pass through a process which takes about 10 years, from insulin resistance to pre-diabetes. Now, these 10 years, if we integrate the NCDs to the primary health, I can pick high blood sugar. High blood sugar and diabetes, these are two different things. What will I do? Just change your lifestyle. Pick what you eat. So I think for me, and I can say for WHO, the primary health care is a backbone for our continent. And I think if we invest properly, spend smartly, as it was narrated here, multi-sectorial, because today, if there's an outbreak of cholera in Kaduma, everybody looks on Professor Pate, but it's a multi-sectorial. there is a sanitation, so there is a Minister of Waters, a Minister of Lands, and let me finish by one last example. Why multi-sectorial here is very crucial. If you look on our outbreaks in the continent, which last year was 109, they are zoonotic in origin. They are coming from the animals. So when we do surveillance, we should expand it. We do surveillance on humans. What about the animals? What about the forests? Okay. So, Mr. Moderator, let me just finish here by really, as I said earlier, what we are doing today in Nigeria, if it's successful, and I believe it will, with what I observed today in the hall, can be replicated elsewhere. And it's high time for our member states in Africa, the 47. I'm just coming from Lusaka. The maternal mortality rate is 85 per 100,000 live birth. So what, let's say, Nigeria can learn from Lusaka, from Zambia? So,
all right, thank you. Thank you very much. You know, you spoke extensively and you've almost exhausted all my questions, but I still have a few more, and I would like to go to Dr. Donald now. Dr. Donald, you know, we recognize your extensive experience in the finance sector, in development finance institutions, and we want to tap a bit from that. You know, what do you consider to be the safeguards and good practices based on your extensive experience that we as a country should consider ensuring accountability and transparency, but more importantly, to the purpose, to the end of attracting capital, more capital for health financing? What are your thoughts on that?
Thank you. Let me sure I understand the question. It's about attracting capital to Nigeria or into...
Yes, it's about driving accountability and transparency, the best practices in this area that help to give comfort to potential financiers, and they're able to bring in more capital for health financing.
I don't know if I have an answer for that. Maybe Mohammed should be the one answering that. So, are you sure I'm the right target?
No, you know. No,
I want to pass this on to him.
Okay. So, please, does any of my Mr. Mohammed or Professor Pate, do you want to help?
Okay. I think I've always said when I grow up, I'm going to be like him. So I want to be like him. I think at the end of the day, resources, whether they are government resources or supranational resources, bilateral resources, multilateral financing, it comes from somewhere. Somebody generates it. And it starts with the taxpayer of the countries, whether it's a Nigerian taxpayer or developed country taxpayers that contribute, whether it's a Global Fund, Gavi, World Bank, or whatever it is, the taxpayers appropriate resources that end up in the global pools. Whether it's our domestic financing that Senator Banigo allows us to have, it's Nigeria's taxpayers' money. So those taxpayers have an expectation that those resources will be used and used well. And those of us that are, let's say, the duty bearers to deliver for the principles of those resources have to ensure prudent use of those. And there are many inefficiencies that are possible. So when you allocate resources in a health system to only the big hospitals, only the urban centers, and everybody that has malaria goes to National Hospital, for instance, to get treated, it's much more expensive. Those could be treated at the primary healthcare level. So by allocating inefficiently, you are wasting resources that are public resources. You could stretch those resources by allocating them where they need be. If you allocate resources that are spent only when people are more severely ill, versus when you go on prevention, you can prevent measles by immunizing children. So you immunize them with a few dollars of vaccines, thanks to Gavi and others, then you prevent these children from getting diseases that ultimately will cost a lot more to be taken care of. So by doing that, you're efficiently using the taxpayer money or the international taxpayer money. So showing that improvement in allocating efficiency is one. But tracking the resources when they are released, whether it's budgetary resources. So in the context of Nigeria, BHCPF, I think there's a good example there. When we disburse funds, direct facility financing, we had an audit. We looked at it over the last several years, and they are imperfect, what is happening at the facilities. We had an action plan by all the states signing up the corrective measures, and when we disburse the resources for BHCPF, for the last seven disbursements in the last 2 years, we do it openly. The media is there. I think Rachel and many others from the media are always there to listen to the dialogue, to listen to the approval, and we also encourage our anti-corruption bodies, ICPC, to track, because it's not just what happens here in Abuja, but when it goes to the facility, is the person in charge aware that those resources are meant to be used for a particular purpose, and so that there are no misuse of those resources, to minimize that. Because sometimes folks may spend the money, but they may not be able to account to it or report it as they should. It's not that they've taken the money away, but they just cannot account for it properly. But to also match it with building the capacities. Finally, using tools of social accountability. We mentioned the National Health Fellows, and there are also other tools that we're using to ensure there's independent monitoring of the resources, the resource flows. There are many mechanisms that the government is putting in place, and I'm sure our global health partners, whether it's Global Fund, Gavi, they have their own ways of ensuring that the institutions, but we cannot pretend perfection, but we have to work on those institutions so that they continue to move from strength to strength. And we tell our development partners in the sector-wide approach that you use our national systems, even if they are weak, use them so that you can improve them. But if you bypass them and create a separate budget somewhere, a separate project somewhere outside government, essentially you are allowing government to waste its resources just so that you protect yours. But why don't you come closer to government and influence how government also raises the standards? So with the sector-wide approach, at least we are beginning to move in that direction. Over time, a few years from now, there should be no project unit, program unit, or delivery unit. No, it should just go to the ministries, but those systems have to be there to ensure that they're properly used. So we're developing those systems as well. Thank you.
Thank you.
So the reason I wanted to pass this on to Muhammad is not that I didn't want to answer your question. I just want to make a point that the health of our people is not about money from outside. It's money from us. And I think Muhammad has done a very good job to explain how the little money from outside can be deployed. So let me ask you a question, just now talk about our own money, not foreign taxpayers' money. And I think there are some simple rules we can apply in our countries, and I think we can get it right. Number one, let us ensure that our taxation system is based on from each one according to their means. So Nigeria's tax to GDP ratio, as you heard this morning, has been quite low. Still is very low. At 11-12% of GDP, that is 3 points lower than the average of countries in sub-Saharan Africa. So it means that there are some Nigerians who are not paying taxes. So the first thing is to say every Nigerian, every African should contribute according to their means. It's so important. Instead of focusing on money from foreigners, which was your question. But number two, often when we fail to collect money locally, we resort to borrowing. There's nothing wrong with borrowing, but it should be responsible borrowing, bearing in mind our capacity to service the debt. So that will be my second point. The third point is that once you have collected the money from your taxpayers, or you have borrowed, hopefully responsibly, you should then be able to deliver services, of which for me, health and education and security are the three pillars of development. And in terms of health delivery, I know Muhammad agrees with me on this. There are what are called the 4 A's. Please, you can quote me on this, there's no problem. The 4 A's as we deliver services. The first A is availability. The services should be available. That is number A1. Number A2, they should be accessible. Because sometimes things are available, they are not accessible. There are many countries who announce you are going to have free education, free health services. That is okay. But then they're not accessible. When you go to hospital, there are no books, there are no teachers. When you go to hospital, there are no medicine, there are no doctors. You have been told they are free, so they are available. But they are not accessible. So that is second A. Availability, accessibility. And number 3, they should be affordable. This is my A3. Because that's what has undermined sometimes public finances in many African countries, including Nigeria. In trying to make things affordable, you have very wasteful subsidies. But then subsidies end up saving actually those who don't need the subsidies. So that is my third A. And then my last A is accountability. You must account for the resources. Remember the 4 A's: availability, accessibility, affordability, and accountability. It is so important for the public finances to generate the confidence we need among our people. Now, the third point about our resources, which I want to leave with you, is that we're not born equal. We don't have the same chances in life. We don't have the same opportunities. So we must be able to carve out resources which protect the vulnerable, which protect those who need safety nets. That's what subsidies should do. Any system which does not provide for the weakest in society will not be unfair, it will not be sustainable, and it will fail. And then the other point, which I think was mentioned effectively this morning, it should be able to pull the risks, because the government cannot do everything. States cannot do everything. But between federal government, state governments, communities, municipalities, companies, individuals, we can pull risks together. That is what we call the National Health Insurance Scheme. It is not a technical format. It is about how do you put all these risks together. And my last point about a viable system which we should seek to build, you have to save for the rainy day. There will be a day when the resources are scarce. Maybe oil prices have gone down, maybe they have some drought or things like that. So for me, Mohammed, colleagues, these are what I call the iron rules, the cardinal rules of public finance. If you get this right, I think we need less and less of foreign aid, which was the question. And I will urge you, as you discuss these issues, if you can zero around these issues, I think we can get it right. Sorry to intervene. I think Mohammed had answered the question very well. Thank you.
Thank you. So, Dr. Donald, thank you for the 4 A's. My next question, 4 A's. Yes, 4 A's. My next question actually speaks to one of the A's, affordability. In the course of this week, we've seen how the poor and the vulnerable have struggled with health insurance. Currently, about 20 million are insured. My next question will be to Dr. Harry Banigo. From a legislative point of view, if we want to increase coverage from 20 million that it is now to say 60 million, 100 million, we have a huge funding gap. While we acknowledge that over the last few years, there has been an increase to funding in the health sector, but, there's still a huge funding gap that we still need to address. And like Oliver Twist, the health sector needs more. What are your thoughts in terms of inching closer to the declaration, the Abuja declaration of 15% of budget to healthcare, or perhaps increasing BHCPF allocation from 1% to 2%?
Thank you very much. I did mention that, thank you for your question, that we already have a bill in place which proposes increasing the basic healthcare provision fund from the consolidated reserve fund, which is presently at 1%, to 2%, and in that to have a dedicated account for immunization that would take care of all the issues around cold chain provision of vaccines, and all the logistics around it. And it will be a dedicated fund. Now, this is where I say I need everybody to come on board this, because it is something that will go for public hearing, and it will need the cooperation of the levels of civil society and various levels of government. I think that this would substantially increase funding for health. But at the same time, we have in our budget an infrastructure fund for health, which is coming up also for the first time. That infrastructure fund for health is very necessary because it covers areas like power provision. We had a bill which puts across at least 50% subsidy on power for the public hospitals, going from the fund that is available for such activities. And we believe that all this can provide additional sources of funding, which we definitely need in the health sector. Also, we agree that a lot of health activities are going on in the private sector. Very many of our clientele, our communities are actually attending private health institutions. So we cannot leave them out. We need to bring them and let them be tell us what they are doing, and see how we can enable them and how we can give them the enabling environment to do what they are doing and be able to provide those additional health care that our people need. And also we mentioned health taxes, which we need a framework for it. We need to have evidence base for that before we can be able to proceed with that. Because those things have, there are pluses and minuses to them. But I do believe that if we have enough evidence-based information and we take the required framework, we can develop a legislation that would work for everybody. And we also, the minister in his discussion mentioned the diaspora. We need to invite the diaspora to come and take insurance for their constituents. Because when I started mine, I did it, I thought, this must be an innovation. And it was an innovation because I don't think any other legislator has done it as far as I know, and has succeeded. Because it was a painstaking process. We actually took time to enroll our members, our constituents. We took time to get them to, before they got their cards, their NHIA cards, and before they could access health centers close to them that are functional, and we had to train the health workers in those health facilities, and also train the HMOs and all that and all that. And then for them to be able to access this, and if a health center cannot, they have the opportunity to be referred to the next comprehensive health center or the general hospital. And so if our diaspora is, and I did this because I noticed that I was always getting calls. Every time I get messages, send me money, my child is having an operation, my daughter is in delivery, my grandfather is sick, and all those things. And I thought, wow, why don't we just try and see how we can cover these people? And these are vulnerable people. So I would encourage that there are still so many other sources that we can expand our the funds that we have available for health. And we need to also sometimes think outside the box. And if we do that, we'll be able to, and also, very importantly, that these funds must be used efficiently. We cannot overemphasize the accountability framework that must go with it. And we need to use, whether it is technology, data, whatever it is, we need to use to follow up this money, to follow up the funds, make sure that they get used for what they are meant to be used for, so that we avoid wastages, we avoid these several vertical things happening when they could just be done in one block. And that way, we will be able to achieve close to what we want to achieve. Not maybe 15%, but we'll be inching closer to it as time goes on. But I know that this government, under our President, His Excellency, President Tinubu GCFR, is committed to ensuring that domestic resources is activated, is mobilized, and it's sustainable, and is willing to bring in funds, even outside, like when he brought in the additional funds for HIV intervention, which now added to the 2025 health budget, was a plus. So these are the things that we have the political will, and I believe that we will get there. I have confidence in that.
All right. Thank you. We've spoken quite a lot, quite a bit around this. I still have a few questions, but I also recognize we are out of time. But because it's a dialogue, I would like to give the audience one opportunity to ask my distinguished panelists one question, such that we can now close the panel session. One question, please. The lady in white, please. We can only take one question. Please, let's make it brief as well. Your voice must be.
Thank you very much. My question is actually for the WHO regional head. As a cardiologist, you've seen a lot of things when it comes to non-communicable disease. Straight up, that's what the region is suffering from now. And let's move from that. Nobody can treat anything that has to do with non-communicable diseases without taking antibiotics and all. This is where we have resistance in the region. Despite progress, we still have weakness when it comes to our One Health approach. So I will want you to just address that, the strategy you'll be using to harness the Region One Health approach and ensure that our borderlines are safe and we can respond to any outbreak real time. Thank you very much.
Cardiology, the outbreaks, and antimicrobial resistance. So I'll try to. One Health approach. Thank you. Yes. No, thank you. About One Health approach, I think I touched a little bit, but let me put it this way. Can you hear me better? I touched a little bit on One Health approach in the beginning there, and I gave an example of our outbreaks. Most of these diseases, they are zoonotics when you talk of outbreaks. You look on Marburg, you look on Mpox, you look at Ebola, you look others which have happened outside our continent, SARS, COVID itself, etc. There is this component of they are coming from the animals and then coming to human beings. I'll give you an example of Marburg, which happened in East Africa recently. In October, it happened in Rwanda, then early February, it happened in Tanzania. It was simple farmers who went to farm near the caves, and their beds there. This is where the transmission came up. And actually, even yesterday, I was discussing with Professor Pate. He told me about an incident which they found some antibodies in the beds. So when we talk of One Health approach, quickly here, how many specialties you see? There is a veterinary part, there is a human part. So we need to approach these outbreaks in that manner. It's a multi-secretarial, and you can touch in most of other diseases. It has to be a multi-secretarial approach. The other thing which, if I heard you properly, is on antimicrobial resistance. It's a big issue in our continent. It's only 40% of the member states which have got a database. So if you ask me today, even how impactful is antimicrobial resistance to our continent, it's hard to say. So one of the things which WHO is going to do is to, because we are not going to any member state to substitute Ministry of Health. No, we are complementing what the ministries are doing. We need to get the database. We need to help the countries with expertise to establish it, because that's the time we are going to know the impact. And then it all goes back to education and everything. Madam, when you got a prescription of 7 days of antibiotic, and most of us, we usually don't finish, where do you dispose those antibiotics? Do they go to the water sources? We know what happens with our animals nowadays, all the antibiotics given. So it's a very wide thing, and we as a normative organ, a technical organ, we are going to work with member states. We have 47, we are in every country which is a member state. And despite the financial crisis, one thing which we have preserved, we are not going to close down any of our offices, which will help us. What we are doing now to finish because of time, we are trying to map our WRs, our representatives, their key questions. We have asked them, they are feeding us, because if we want to move forward, we have to know what is Nigeria doing, what is Ghana doing, what is doing. Because we can collectively bring the expertise within South to South collaboration.
Sure.
But end of the day, really, I would like to underscore the importance of primary health care, the insurance. That's where we can cover all the vulnerables. Thank you. I'm not sure if I've answered your question collectively.
All right. Yes, go ahead, sir.
I'll just put something that didn't come up in the panel and hasn't come up all day, but which is, I think, very important. Minister of Finance mentioned health is key to human capital. It's a cause and a consequence of human capital accumulation. As we accumulate more human capital, as we get prosperous, we invest more in health, we invest health, we build human capital. But there's a dimension that I also wanted to bring, which is the dimension of social capital. Health can contribute to building social capital. So in our country, we are challenged, there are lots of divisions, all kinds of requirements for healing. By coming together to address the health needs of our population, in fact, we can forge improved social capital, and that itself can help us grow even further. I mean, Donald here is from Rwanda. I think one of Rwanda's secret is not necessarily only the technical part, but the pool of social capital that they had in the post-conflict period helped address those needs. Because then you have to look at the poor and vulnerable and saying, let me look not only at myself, but what is it good for society? What are the commons, and how do we preserve the commons? And public health spend is, in fact, for the commons. Because if you prevent TB, you deal with HIV, you deal with malaria, you deal with antimicrobial resistance, you deal with pandemic preparedness, it's for the commons. You deal with environment, it's for the commons. So there's that dimension. So the financing has dividends in human capital, but I think it also helps us build social capital. That's it. Thank you.
Fantastic close to our panel conversation. The coordinating minister, has just expressed how health can help to build social capital. So help me to appreciate our distinguished panelists for the conversation. The conversation continues.
Thank you very much. Honorable Minister, traditionally after a panel, we do take group photographs down here. If you could just kindly join the Honorable... Honorable Minister, distinguished Senator, I've been asked by the gentlemen of the press that you would have better shots on stage, actually. I think, please... The DG NHIA will join them, and the Permanent Secretary, Federal Ministry of Health. Ma'am, could you please also join the panelists? Invited her. I called her. Thank you very much, Honorable Ministers. Ladies and gentlemen, as we just take our seats, it will be my honor to immediately invite the DG Budgets of the Federation, Mr. Tanimu Yakubu, to please come and quickly give his presentation. As you know, we're discussing health and finance. We've listened today to the Honorable Minister of Budget and Economic Planning, Honorable Minister of Finance and Coordinating Minister for Economy. It is now my pleasure to invite the Director General of the Budget Office of the Federation to also speak to us. DG, please. DG.
Honorable Coordinating Minister of Health and Social Welfare, the Permanent Secretary, Federal Ministry of Health, distinguished colleagues, ladies and gentlemen, achieving universal health coverage in Nigeria requires sustained public funding. We have made progress through the Basic Health Care Provision Fund, expanded immunization support, and implementation of the National Health Insurance Authority Act, including the Vulnerable Group Fund. New initiatives such as the National Catastrophic Health Insurance Fund and the Renewed Hope Medical Relief Program are strengthening our system. On budget implementation, the revised bottom-up cash plan has improved accountability and fund utilization across MDAs. In 2024, government revenue reached 24 trillion naira, close to target, but debt service continues to put pressure. Encouragingly, the health allocation rose by 76% in 2025 to 2.61 trillion naira, with capital funding doubling. The Basic Health Care Provision Fund was fully released, and utilization in the health sector is above average compared to other MDAs. Still, challenges remain. Tardy compliance with procurement rule slows implementation. Looking ahead, we must raise Nigeria's revenue to GDP from about 10% in 2023 to 18% in the medium term. Early preparation of budgets and procurement will help avoid delays. Health institutions should strengthen their internally generated revenue systems with greater transparency and efficiency. Above all, we must pursue more statutory earmarking of critical health expenditures. In conclusion, funding is improving, but implementation must catch up. The Budget Office is enhancing performance tracking through tools such as the vaccine tracking system to ensure efficiency and minimize wastage. With greater coordination, early action, and fiscal discipline, the health sector can become one of Nigeria's top performers. Thank you.
Thank you very much, DG Budget. Sir, I've been requested to just ask you to take a seat up here because we'll just be convening a panel that we would have you on just briefly. I would just want to immediately invite Dr. Taiwo Oyedele, who is here with us. He's the chairman, Presidential Fiscal Policy and Tax Reforms Committee, to also take to the podium and speak to us. He'll be discussing more money, more problems, optimizing. No, he's going to be speaking to us innovative financing mechanisms and fiscal policy options for increased resource mobilization for health. Dr. Yedi, will you please? You're welcome, sir.
Thank you very much. And I think it's afternoon. Good afternoon, Honorable Coordinating Minister of Health and Social Welfare, distinguished ladies and gentlemen. You please permit me to adopt the protocol that has been properly established in the interest of time. So I'm delighted to be invited to speak on this very important topic. And what I want to do in the few minutes allotted to me is to give some context and also share my perspectives on what we can do differently, including those that we have done in our new tax laws that we are quite excited about. So once you talk about, if you can go to the next slide, if you talk about health, I think we need to broaden the conversation in terms of what it really means. And I'm sure that has been thoroughly dealt with, including mental health, your well-being, and those that are physical, even our persons with disabilities. When you talk about financing health, we should think about both the direct financing that we need and the indirect ones. And what do I mean by that? So if you're buying drugs and you're paying the health personnel, you will think about health finance. But how about the electricity to power the equipment? What if there's no road to get to the clinic? So when you are building roads and you're providing electricity, you are funding health as well. And I think it's also important to look at this, not like we're doing some of our citizens any favor, because all of us are vulnerable. Many of us who consider ourselves to be middle class, upper class, high net worth individuals are just maybe a few minutes away from anything that could change the course of our lives. And we do know there are instances when some health challenges could be bigger than any amount of financial resources that may be available to you. So therefore, I want to try and highlight a few points in terms of financing health and doing so in a sustainable way. If we think about health as investment in people, which we believe pays the best dividend, only healthy people will think about education. Only healthy people will think about progress and think about anything else in life that you can consider. I think it was this Chinese philosopher who said that a healthy man has 1,000 wishes, wants 1,000 things, but a sick man has only one wish. That's to get well. So the first thing is about having a robust health policy. And this health policy, it's about how we decide as a people to moderate, educate, and incentivize the right behaviors. You would agree with me that just educating our people well can prevent a lot of health challenges that we may then look for a lot of money to cure subsequently. And that would also include having a policy around food and nutrition. Some of the data I have looked at myself, because you work Mr. President asked me to lead a team of very patriotic Nigerians to do for our country required that we look at a lot of data, including in the health sector. And sometimes I ask myself whether we are really digging the data the way we should. Sometimes it's a distinction between correlation and causation. Sugar, for example, can give you health challenges, but so also is carbohydrates. If you eat it in excess, I'm not a medical expert and I'm not pretending to be one. Are we able to establish those things within our context? Because Bloomberg says context changes everything. And if we develop all of these, developing the health policy means you have to think beyond health itself. And I was glad on my way, I was watching this program on channels. And I listened to the Honorable Minister of Finance and Coordinating Minister of the Economy, and the Honorable Coordinating Minister for Health and Social Welfare seemed to have even summarized everything I had.
Are you a tech enthusiast? Perhaps you want to know more about the devices and gadgets you use. Tech Mode will bridge that gap. Connect great minds while exploring everything about technology as it concerns you.
It is Tech Mode.
Tech Mode is unlocking your tomorrow today.